Good afternoon, everyone. Good afternoon, everyone. My name is Dennis Clements. I'm the Director of Undergraduate Studies for the Global Health Institute. And for the students, this is our capstone project. So you'll identify with what it goes through to do these presentations, et cetera. We have to do the same things you do. I want to wish a good afternoon to all our global health majors, their families and guests. Thank you all for coming. And my colleagues, and to welcome you to the commencement ceremony honoring our 2019 graduates of the global health major. Today we honor 47 global health major graduates who have traveled a great distance, to get to this celebration over 4 years, and so have their families. If you count, 43 will be here because 4 aren't, just for those of you that are compulsive about that. At Global Health Institute, we develop close relationships between and among our students, faculty and staff, and act as an additional support for students as they spend their time at Duke. This is facilitated in part because of our efficiently small size, but more because of our dedication to our students and their aspirations. The Global Health family has been here to help these students manage the rigors of a double major, and we know the families have been equally supportive. Fellow students also helped in many challenging courses and demanding projects. Faculty coached them through tough times and equally rejoiced in their successes. I want to thank the faculty and staff for their dedication to these students' success. I'd ask the faculty that are here, please stand and be recognized. And in particular, our education staff has worked tirelessly to support our students every day, myself included, by the way. Laura Bai, Sarah Martin, Lisa Mackeen, Erin Degerman, Kate Sullivan, and Emily Bakir. Would you please stand? I want to acknowledge and thank students for being there for each other and encourage you to continue to support each other as you move on to your next adventures. We arrive at these ceremonies knowing that students, through their diligence, families through their support, and faculty and staff through their guidance, all participated in helping to arrive at this glorious moment. These occasions remind us that, like in global health, all things worth accomplishing usually can't be done alone. Thank you. I'd like to now ask Megan to come up and give us some remarks.
Thank you, Dennis. And thank you for making it acceptable get choked up if I get choked up during my speech too. Please excuse me. So good afternoon, parents, families, and graduates, and congratulations to everyone sitting in this room. As Dennis said, each of you has played an important role in getting our graduates to this point. So this is a big day and a big weekend for all of you here. I want you to soak it all in. When I was asked to give some remarks today, I was excited but somewhat nervous because I realized I had not been to a DGHI graduation ceremony before in its entirety. I've been at Duke a few years and was looking forward to attending last year, but as David Toole started his remarks, I received that dreaded call from my daughter's school and had to duck out to take care of a minor emergency. I think many parents here are glad you're not getting those calls anymore. That meant that I missed hearing David's words of wisdom, and I had to have a talk with my daughter about stepping up her game a little bit. I told her she's not going to make her way to Duke if she continues to stick mulch up her nose on the playground. She needs to make better decisions because I don't want to see her graduate wearing the wrong shade of blue. So in figuring out what to say today, I decided that, like I did for her last year, I'm going to use this time to give graduates some words of life advice from my experiences not only as a parent and a global health researcher, but as a Duke grad myself. Yes, 20 plus years ago, I sat in this very room, not 1, but 2 years to slog through freshman and then organic chemistry. But first, parents in the room, you've done it. Your kid has gotten through those playground mishaps, and now they're on the brink of graduating from one of the best schools in the world, and as Dennis mentioned, with not just 1, but 2 majors. You've made it through those sleepless nights, the diaper changes, that full circle of waiting for their first words and then wondering, are they ever going to stop talking? And then all too quickly wanting and needing to hear more than just a few words or sentences as they run from activity to activity or send you the occasional text, and it all goes by too fast. So in celebration of this graduation and Mother's Day weekend, I'm going to ask the graduates to give your parents a small present. I want you to tell them a story, talk their ear off, and give them lots and lots of details. I promise you they will cherish that. So, I can remember many years ago the particular beauty of Duke and Durham during my graduation, as if the weather was colluding with the school to make everything just a little more beautiful and more poignant during my last few days at Duke. Well, it turns out it was not my last week at Duke, which brings me to my first piece of advice for the graduates. Never say never. You never know where the world is going to take you. When I moved out of my ramshackle house in Trinity Park and said goodbye to my friends, I knew that the friendships and experiences I had had at Duke would stay with me forever, but I had little idea that I'd be able to join the faculty and teach Duke students almost 20 years later. In fact, while I was an undergrad, I was a history and women's studies major and toyed with the idea, seriously, of getting a PhD so that I could come back and teach one day at Duke. Until my favorite professor told me that 4% of PhD history graduates get jobs in academic institutions and not at places like Duke. So I went back to my original plan of being a doctor, which seemed a safer bet, but I didn't ever give up on my goal of doing research or teaching, and over the years I continued to harbor a secret dream that I would come back to Duke and teach a women's studies course. I spent a lot of my career focused on the intersection of gender and health, and I learned that there are a lot of different and valuable ways to address issues that are important to me. So that's my second piece of advice. It's not have a backup plan. It's that there's not a single path to get you to where you want to go, and not just one destination. And as you make your way along these paths, you'll probably have some pretty great experiences and grow. I was able to do a Fulbright year in Barcelona, which morphed from a study of the history of the women's movement to a study of the impact of women's social status and lack of protective policies on their health. That may sound familiar to some of you guys who've taken my class 20 years later. That drove me to seek out more global health opportunities in med school and ultimately led me down the path of an OBGYN residency so I could be directly involved in women's health care. As I went through a busy high-tech residency in New York City, I found myself wanting to take a different path. Rather than the daily patient care, I wanted to have a wider impact on women's health, to be able to address some of the structural factors that were profoundly impacting the health of my patients and their communities. So I packed up and moved to San Francisco for a global health research fellowship. I went back to the classroom to get my master's in public health. And then my path took me to Africa to work in HIV clinics in Western Kenya. It was not my parents' first choice of career and life trajectory, but they were supportive because they trusted me, they had some faith in my Duke degree, and they knew I would do it anyway. Does that sound familiar to parents out there? Can you think back to your first response, spoken or maybe your internal voice, when your child called or just texted, "Hey guys, I'm going to spend the summer in Togo or Madagascar or Nepal. I have to. It's a requirement for the global health major." Yeah, that's true. To get this degree, our seniors had to spend time doing experiential learning, and for most, that meant travel to a foreign country. And our graduates went to 17 different countries. For some, though, it meant staying in the U.S. and studying policy somewhere like New York or D.C., or looking at health disparities in places like right here in Durham. The mission of DGHI is to promote health equity and social justice, and as our graduates have learned, these concepts do not have geographical boundaries. And many of our graduates say that their fieldwork was the most meaningful experience they had at Duke. For some, if not all, it was a daunting prospect. They had never done research, never lived abroad, or even visited a developing country, and now we're asking them to buy tickets, get vaccines, meet the classmates with whom they'd be sharing close quarters for a few months. As Lisa McKean, who runs our experiential learning program, tells them, they needed to expect the unexpected. Well, families, our graduates are passionate, smart, and adventurous. And these experiences really showed the breadth not only of their talent, but of their adaptability. They come back more confident and more aware of the world around them, both globally and here at Duke. So I'm going to add a little piece to Lisa's advice of expect the unexpected and say, don't be afraid of failure. Believe me, fieldwork is just a taste of the real world, and part of the value in this is learning how to adapt when things don't go as expected, learning how to fail with grace, and then try again. Because failing means you've tried something new and important, and you've pushed yourself. But accepting failure requires humility, so I'll add that piece. Be humble. And sometimes that's a hard one. We all went into global health so we could help or save the world. And we're from Duke, so we know a lot, right? We should have some of the answers. But we always need to remember that that first step is to listen and let ourselves learn and know when we don't have the answers. And I speak from experience. I've certainly had my share of failure. In fact, I might say my career has been defined upon some failures. When I moved to Kenya, I worked to develop a cervical cancer screening program that was plagued with daily interesting challenges that were completely new to me. I had to learn the local context and figure things out, from how to make acetic acid, where to buy the ingredients, how to sterilize supplies with charcoal, how to jerry-rig a method of immunohistochemistry staining with a rice cooker. We may not know what all these things mean, but suffice to say in the US, we are not using grilling or kitchen equipment for our clinical care or research. But I learned to be okay with the unexpected and actually enjoy it. It pushed me to adapt and try new things. And we developed a great program. So by the end of my fellowship, I felt like I was a global health success. And then we took the show on the road, and we worked with the government to develop a plan for cervical cancer screening that would reach women in remote areas of the country. I found funding to supply the clinics. We trained the staff. We signed these things called MOUs, Memorandums of Understanding, so we were official. And I could say that we experienced some greater challenges because we were attempting greater things, or I could be honest and say it failed. No amount of alteration would fix this program. So I had to accept that and either give up on screening or learn from the failure. So my path took me towards something called implementation science, or the science of how to make things not fail in the real world. We looked at what went wrong, what were other options, and we ended up getting an opportunity to try a more effective strategy that has been much more successful and has had a much wider and lasting impact, not only on the population I work with, but on my career. So that initial failure has become part of my story, and I own it and talk about it, not just because it's part of my journey, but it's a big part of global health and life in general. So this brings me to the last piece of advice as you go out into the world with your brand new Duke degrees. Don't be afraid to take chances. And that one comes from my heart as a global health researcher, a Duke alum, and a mom. You guys are made of some great stuff. And here you've had foundational experiences that should help you have the courage and confidence to try for that awesome job you think you may not be qualified for, seek the next adventure, make the big career move or the actual move across the country or around the world. Sorry, parents, but some of them are going to want to do that. And importantly, make sure you take some chances in your own lives. At some point, you'll be considering asking out that cute guy in the coffee shop or saying yes to a second date with someone. Later on, offering or accepting a marriage proposal, and at some point even contemplating how children might fit in your life. These are all potentially daunting decisions, and they are what life is made of. So don't be afraid to take a chance on something important. So why am I giving you all this advice now? Haven't you learned this over the last 4 years? Because right now, as we send you off, the world is at your feet, and I, along with the rest of the faculty or family, want to see what you can do with all of this talent and passion. You are leaving this Gothic wonderland to enter a world that you will help change and a future that you will shape. And I am very optimistic about that. Among the future doctors, researchers, techies, policymakers, and advocates, we have a group of amazing thinkers and doers who will redefine what it means to practice and lead in global health for the next generation. I can't even predict some of the achievements we'll see, but I know I'm looking forward to living in the world you shape and learning from every single one of you graduating this weekend. So let's take one more round of applause to congratulate the graduates and their families. And now I'd like to introduce CHAYA BHAT, one of these amazing world-changing seniors, who's going to say a word to her graduating class.
I am not CHAYA, but I am testing the microphone because some folks in the back can't hear. So don't mind me. Thank you. Just get a little closer. Okay. Okay.
Can everyone hear me? Yes. Lovely. Well, good afternoon, friends, family, faculty, and staff of DGHI. I could not think of a better way to kick off graduation weekend than by being here together. Thank you, Dr. HUCHKO, for the introduction, and thank you to my peers for nominating me to be your student speaker today. I'm so honored to be standing up here. I came into Duke, like most of my fellow undergraduates in this room, bright-eyed and bushy-tailed. Straight out of high school, I was aware of about 10 jobs that existed in the world, and Duke would somehow get me to one of them. I was confident. So I joined the scores of newbies on campus, flocking the C1 to get to our slightly too large Chem 101 class in this exact room. After painstakingly taking a series of large introductory classes my freshman year, I just didn't enjoy any of them. I was on a pre-medicine track, but really lacked a strong reason to want to be. It was indeed one of the 10 jobs I was aware of pre-Duke. And let me give you an insane spoiler alert, I'm not going to medical school anymore. However, I did drop all of my classes in the first week of my sophomore year and sit in my Cohane dorm room wondering where I would go next. I had a friend sit me down and ask me what I've loved best about Duke, and my response was simple: the people. People at Duke are passionate, and they're not afraid to share what they love. When my friend followed up by asking to see my book bag of potential classes, 4 out of 5 of them were in global health. And it makes sense. All of the global health class titles or descriptions were so intriguing to me because they were about people, whether it was directly about a specific population or community, or indirectly about pressing health issues that affect the most underserved areas. So I took a plunge and I enrolled in 3 global health classes that semester, and it was the most intellectually intriguing semester I've had. I know that this isn't the story for everyone here. To try to generalize the global health experience at Duke would be a disservice to the diversity of voices and backgrounds of the students sitting here. There's a reason we're asked to choose a co-major, and there's a reason we're not all the same co-majors. Global health came into each of our lives in a different way, and willingly or not, it has stayed a part of our lives the past 4 years. For some of my peers sitting in front of me, you all were smart and found global health before Duke, as many of you were a part of the freshman year focus group. Although you did also willingly elect to live in the Pegram dorm, so were you really that smart? But for others, global health came from a decision to try out that Global Health 101 class your roommate recommended, to follow an academic interest in an elective, or even from a meltdown. For me, global health has become a way to make a personal commitment to ideas and issues that I care about, to study them, to understand them, and to try to make a difference. That same semester where I began to take my global health classes, I also joined a Vast Connections team, the Global Mental Health Integrative Training Lab with Dr. Green and Dr. Puffer. Freshman year, I had lost a close friend back home to suicide. Amidst the big classes I was taking and new college experiences that I was inundated with, I struggled to stay rooted. I struggled to find meaningful ways on this campus to honor his memory. And though I had no prior experience with global health, psychology, or mental health at this point, Dr. Green and Dr. Puffer both took a chance on me. And willingly or not, they have let me stay a part of the lab for the last 3 years, instilling in me a passion for mental health and mobile health. And for that experience, I am so grateful. Throughout the various projects we have worked on together, one principle has remained clear. How can we best use our knowledge and our resources to address health inequities that are rooted in cultural, geographic, and socioeconomic differences? It has reminded me that by being at Duke and by being a global health major, I and all of us have a moral responsibility to utilize the tools we have been given for good, whatever and however good may look like to you. I am fortunate enough to be standing up here today to share bits of my story with you all, and while my story is unique stories are abundant in this room. I encourage you to tap on any graduate's shoulder during the reception and let them share their story with you. There's 47 of us sitting here, eagerly awaiting the coveted Duke degree in global health. But have we really thought about what that means? Global health. I remember sitting in Dr. Toole's class, Global Health Systems, last fall. On the first day, he told us that the class would be broken down into 3 components, literally global health systems. He challenged us to think about the weight that each of these terms carry on its own. I had never been pushed to think more specifically about how we actually define the terms that are the title of our major. But doing so in this class, my senior year, pulled together the learnings and experiences that I and so many of my peers have shared. So today, I want to share some of my reflections on what these terms mean to me. Global. A seemingly simple word. I'm sure most of you had that picturesque globe image pop into your head. But what exactly does it mean for a place, person, or issue to be global? What stake do you have in ensuring access to healthy water for a population that lives so far away from you? What stake do you have in ensuring access to fruits and vegetables for a population that lives in a food desert so near to you? This is a major that supports students in charging at the world's most pressing issues, whatever and wherever it is. I know of peers who have traveled to extremely remote parts of the world, thousands of miles away, to conduct field research and to learn in different cultures and languages. But I also know that in my capstone class, all 4 groups chose to focus their projects on the state of North Carolina, working to target the systematic reason that the state experiences food deserts, a desperate lack of school nurses, and low HPV vaccination rates. The world is only as big as we let it be. Health. Listening to my peers and my professors, I am fascinated with the ways that their projects and passions tackle a different aspect of health. In my research experiences, I have focused on health in the context of mental health and emotional well-being, in areas where professional resources are far and few in between. But in my friend Ellie's experience, health is rooted in socio-environmental factors of childhood obesity. And in my friend Sarah's experience, health is rooted in best practices for sustainability and supporting those with disability. I could go on for hours explaining the variety of ways students here have been empowered to address their definition of health. And that itself is a testament both to the complexity of the problems we are trying to solve and those we still have yet to address. Systems. The Global Health Institute is one big system, or a complex body with a specific purpose. The people, students, professors, and staff are the key inputs or drivers of the system's constant innovation. Over the last 4 years, my peers and I have taken many of the same core classes, whether it was entering Global Health 101 with Dr. Legrand or devouring Dr. Clements' brownies in Capstone. Our shared experiences are markers of our journey, but the level of collaboration instilled in our academic and research work is a testament to the relationships we have developed. What I love and appreciate about the Global Health Institute is that it is one in which we can challenge and learn from ourselves. I love that it is an institute where we can share experiences through a variety of media, including the iconic photographs you see showcased across Trent Hall. But I also love that it is a forum where students can feel comfortable asking us to pause and to think about our privileges and positions in sharing certain photographs. This institute is a system that learns, grows, and gives. As we leave this weekend and transition from Duke undergraduate students to alumni, the future can feel very daunting. But we have to remind ourselves that we never actually leave the system that is Duke and the Global Health Institute. Our role as alumni with a global health education is to utilize the tools we've been given. And this role is a powerful one. Previous global health alumni have set exemplar paths for enacting change in the world. We've seen individuals build their own startup, pursue advanced degrees, and even make it to the royal wedding. As we leave this weekend, I challenge you to think about what this program has given you, both in terms of academic and life experiences, and the responsibility we bear to share that knowledge. Thank you.